So I had some questions recently relating to coming off of a psych drug, how to do it. And I highly recommend you do this, but it has to be done correctly. And what I mean by that is it has to be done under your doctor's supervision. Why? Because if you are, number one, dependent on a psych drug, you've taken it for a long period of time, and you come off of it too quickly, chances are you're going to have side effects, okay? So you want a very slow transition off this medication with supervision. Number two, if you're taking a natural remedy and your drug at the same time, because a lot of these drugs work to block the recycling of a neurotransmitter, so you end up with more of a neurotransmitter. So if you're also taking something like St. John's wort, at the same time you're also taking this selective serotonin reuptake inhibitor, you can end up with too much of a certain neurotransmitter and creating other problems. So get some supervision, find a doctor who's willing to work with you. If your doctor is not willing to work with you, find another doctor that is willing to work with you. Because the longer you're on this medication, the more the neurons are dependent on this medication. So any alteration can really throw your body out of balance. However, you should start with a diet change. And I'm talking about healthy keto. That means nutrient-dense type foods with low carbs and higher amounts of fats with intermittent fasting. Why? Because both of those are going to significantly affect your brain in a very positive way. It'll lay a foundation so it's going to be easier to come off this medication. Both a low-carb diet and intermittent fasting will not act as a drug. It'll act to help you improve your mood. Then if we add exercise to it and you add vitamins, minerals, trace minerals, essential fats, and I'm talking about omega-3 fatty acids, all of that is going to significantly help because that psych drug is also depleting you of nutrients, and so chances are you're deficient. But I wanted to create this important video just to emphasize the point of a slow transition that's supervised by someone that actually can help you do this correctly so it's not a sudden change. So you can eventually come off this drug because you don't need it anymore, because your body's back into balance and you did it in a correct way. In a randomized controlled trial involving 60 people, they compared the effectiveness of using curcumin to Prozac. And they found that curcumin is as effective as Prozac without some of the side effects. Now, what are the side effects of Prozac? Quite a few, and this is just a very short list. Nausea, headache, insomnia, diarrhea, fatigue, weakness, with rare side effects of chest pain, severe dizziness, painful erection that can last for over 4 hours, and there's many, many more that I didn't list. And by the way, check with your doctor before taking this advice. I'm not telling you not to take your Prozac. This is just a study to share with your doctor, and I'll put the link down below, that has some pretty interesting effects, especially if it can work as effective as Prozac without the side effects. Now, how does curcumin work? Well, in one way, it can increase BDNF. What is that? Brain-derived neurotrophic factor. BDNF increases a protein that helps your neurons make new nerve connections. And depression is linked with a decrease in BDNF. In fact, brain disorders in general are linked to a decrease in BDNF. Also, if you're low on this factor, it can lead to a shrinking hippocampus, which is involved in memory and the capacity to learn something. Curcumin also has the ability to increase serotonin as well as dopamine, both involved in your overall mood. Now, if you're going to use curcumin, I would highly recommend that you also change your diet and you start doing fasting, which can have a huge effect on your mood. I would also increase vitamin D, add probiotics, start exercising, and definitely get on a low-carb diet. If you're new to my channel, I put a link down below of exactly what you should be eating. Benzodiazepine, okay, this drug is used for anxiety, panic attacks, insomnia, and sometimes epilepsy. I want to give you a natural alternative to this drug. And so this drug tends to manipulate a couple neurotransmitters. One is serotonin, another is GABA, and another is noradrenaline. Now you might know what serotonin is. It actually brings up your mood, it helps anxiety, it helps with cravings, it makes you happy. But noradrenaline is a slightly different neurotransmitter than adrenaline. It helps to focus your attention. It helps increase something called vigilance, which is feeling awake, alert, responsive to a stimulus like danger, like you have this heightened awareness. Also, noradrenaline helps counter depression. It can increase blood pressure if your blood pressure is too low. It helps someone mobilize their brain and body, so it gets them into action. Okay, so that's what noradrenaline does. And so it's lowest when you're asleep, and it's highest when you're in the flight or fight mode. So there's a natural remedy which actually has been found to work just as good as benzodiazepine, and that is called magnolia bark, right? You might have a magnolia tree in your backyard, but this bark has some special properties that mimic this drug. It has anti-anxiety qualities. It can help you decrease cortisol. It improves sleep. It makes you calm by increasing something called GABA. It can inhibit epileptic seizures. Number 4, it supports menopause. Or number 5, it relieves depression by increasing serotonin and noradrenaline, which we just talked about. Number 6, it can even decrease the fatty liver. And number 7, it has properties of cancer inhibition. So if you're on this drug, definitely check with your doctor before coming off the drug, but present this other solution as a little test with your doctor to try something more natural, to see if you could possibly replace this drug with lots of side effects with something that doesn't have a lot of side effects. All right, thanks for watching. Hey, before you leave, I just wanted to give you a little quick history on some of the books that I wrote. This was one of the first books. It's called Dr. Berg Body Shapes. It was my attempt at writing about body types. What was very interesting about this book is I actually did all the images myself. Don't ask me why. They look actually not quite as professional as some of the images that I have in the new book. But anyway, this is my first attempt right here called Dr. Berg's Body Shape Diets. And then I wrote a book more extensive called The 7 Principles of Fat Burning. I don't even have a copy anymore, actually, because it's outdated. The next book, I put about 1,000 hours into this one right here called The New Body Type Guide. Major updates on the body types. I put a lot of energy into this. It has professional images, graphics, all sorts of things. Now, the problem with this book is it doesn't really describe what this is really about. Body types are only a small portion of what's in this book. And that's why I changed the name to the Healthy Keto Plan, okay? If you happen to have this book, you don't really need this book because there's some only very, very minor updates. But if you don't have this, you need to get this one right here. This book goes into every single detail that you would ever want to know about. It goes into the 7 principles of fat burning. It goes into hormones, the body types, the basic keto plan. It goes into intermittent fasting. I talk about the 10 fat burning triggers and blockers and fat burning strategies with a lot of details in every single chapter. I go into body issues that interfere with losing weight. There's very few people that just have a weight problem. They have a lot of body issues, whether it's sleeping problems, stress problems, inflammation, menopause. I cover that extensively in this book. Then I talk about how to get rid of stress, and I show you a technique. Then I get into exercising. And then I have a lot of really good recipes in this book as well. So this is a good reference guide. On my website, if you get this book, you get this one free. It's called Healthy Keto and Intermittent Fasting. This is the shortcut, quick guide to this book. And the reason I created this book is to have you, within 45 minutes, learn how to do keto, okay, in intermittent fasting, exactly what you need to do. Then you can fill in the blanks with this book right here. So right now I'm doing a special. If you get this book, you get this one totally free, or you can go to Amazon and get these individually. So I just want to clarify the difference between this book and this updated one right here. If you don't have this, you need to get this right here. That way you can get the exact correct information to do it healthily.